Well, now on the doctor who, in the last hour, won her Court of Appeal challenge over the decision to strike her off. Dr Hadiza Bawa-Garba had originally been suspended following the death of 6-year-old Jack Adcock and was later struck off following an appeal by the General Medical Council. Joining us from outside the High Court is Dr Cicely Cunningham from the campaign Learn Not Blame. Hello to you, Doctor. Thank you for joining us on Sky News this afternoon. Responsible for the death of a little boy, but not struck off. Where are we with that?
So thanks for having me on, Kate. And first of all, I would just like to say how sorry I am for the Adcock's loss, and indeed for many of the patients and families who I've talked to over recent months since this case has been in the news, that people have suffered harm within the NHS. This is a very difficult situation. Medicine is innately high risk, and unfortunately people die. And one of the key unknowns about this case is actually whether Jack might have died anyway on that fateful day.
But she was convicted, wasn't she? And she was found to be responsible. So, you know, we are where we are as far as that is concerned. But you don't feel, even given that she should be struck off?
So the judgment today was very clear. The judgment today was about whether or not she can practice as a doctor and her competence as a doctor practicing. And the judgment made very clear that the conviction of gross negligence manslaughter stood. They felt, the judge, who was the Master of Roles speaking today, noted that within the sentencing that was given to her, it was felt that her offence fell on the more lenient side of that conviction. But nonetheless, the decision was actually about her competence going forward, and that was a decision taken by the Medical Practitioners Tribunal, which was a separate process. The Medical Practitioners Tribunal is a tribunal that looks at doctors' fitness to practice. It looks forward. It is able to take all the systemic factors into account in every case. And the matter was raised that this was a doctor who had never previously had any questions about her competence raised. She was thought to be an outstanding doctor, and she had had no complaints regarding her care of any patient. She was in the top third of her medical school year, and she continued to practice until the point that she was prosecuted within the hospital with appropriate supervision put in place, and then subsequently was found to be competent.
Yeah, but nevertheless, a little boy died under her care, and mum of that little boy has said that she doesn't think that this is a reasonable decision, and how could any patient rely on her to have good care in the future? What would you say in response to that?
So my heart goes out to the Adcock family, it really does. I'm a mum of 2 young children. I have a 4-year-old and a 2-year-old. And one of the things that I did this week was collate some messages of support to Hadiza, and many of those were from doctors and ex-colleagues who also have children, who all said that we would have no hesitation in allowing our children to be treated by Dr Hadiza Bawa-Garba.
So the issue is not the doctor per se, even though she was convicted of the manslaughter, but because she didn't have a support structure in place to help her when she needed it?
So there were many features of the day when Jack Adcock died that led to a less than optimal situation. It's well known that an individual's performance as a human suffers when there is more than one task to do. There are some very simple things you can find on the internet, such as an invisible gorilla test that you can show to your friends and see if people notice a gorilla when you're trying to do another task, which is counting how many times people pass a basketball. Dr Bawa-Garba that day was not only doing her job, she was doing the job of another registrar who was away. She was dealing with the fact the IT system was broken for 4 hours. Her 2 junior doctors were very new to paediatrics. It was shortly after people had rotated, so she was very closely supervising them. She had multiple sick children. She was covering 6 wards over 4 floors, and she was doing other procedures such as a lumbar puncture on a small baby. So in isolation, if Dr Bawa-Garba was able to look after just Jack Adcock, my question would be whether she would have been able to do things more promptly. rather than in the system that she was working in, where she was clearly under stress.
So rather than the doctor, it's very much the system and the shortage of staff that is responsible for this little boy's death?
So these things need to be taken into account. I think what's really important is to think about accountability for families. And again, I've talked to many patients and families over the last few months, including people who've lost children. And I cannot begin to imagine how awful that is. Every day I go in and look at my children and think how beautiful and how lucky I am that they are alive and healthy. But there are many people who have, and equally with less than perfect care, have been able to use their experiences to campaign for a safer NHS, to campaign for a better NHS. For example, the inspirational Melissa Mead, who campaigns on sepsis, James Tipcombe, who lost his son Joshua in the Morecambe Bay Hospital, and many others, including patients who've suffered harm to themselves, such as Susanna Stanford, who experienced a caesarean section that she could feel the pain from because the spinal anaesthetic hadn't worked. All of these people are campaigning for an NHS where there is learning coming out of a negative experience. And that's very much at the Doctors Association UK. We're running a campaign called Learn Not Blame that we hope will be taking off in the next few months. And that's very much about saying, I want to be part of a culture in the NHS that is just for everybody. And that includes justice for patients and for families and improved, safer care.
I know that we recently spoke to a pilot, actually, an airline pilot, who has a system in place that he's introduced to the National Health Service. I believe his wife, sadly, having lost her life during a routine procedure, but they now use the techniques from the cockpit that hopefully will help save lives. So fingers crossed as far as that's indeed so, Martin Bromley.
Who's an inspiration as well.
He certainly is that. We've interviewed him actually here on the programme previously. But a final thought for the parents of this little boy.
I can only say again how sorry I am as an individual and how sorry many of my colleagues are for their loss.
OK, we appreciate you taking the time to speak to us, Doctor. Thank you very much indeed for joining us. Thank you.
Thank you.